Start.
I am Professor Dr. Vivek Gupta and Senior Consultant Cardiologist, Apollo Hospital on 13th of June. As I showed you in the last video, we had done an angiography which was having a 95% stenosis. So every case is different, and I would like to introduce my team, Mr. Chandan, Madam, Ratika, and other staff members. So what we are planning is, at this point of time, we have already done a pre-dilatation. This is the guiding catheter. So here, this is the guiding catheter. This is a wire which has already gone inside the coronary artery through this system. And now with this system, we will inject the dye through here. So we can see this here. Show the previous shot. This is the balloon in the middle, you can see, which is going to pre-dilate. Next view. Next. 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 You can see the wire inside the coronary artery. And this is the final view after putting and dilating with the balloon. The next point is now we have to do stenting. Yeah? Come back to me. And I will show you how the procedure of stent is done. 330. Okay. So this is the coronary stent system from Bioclinic, and this is coming like this. And if you can see, the stent is a hollow cylinder. Come nearer, they come near. And this is a stent which is actually on the balloon, wrapped over the balloon. So we have already used the balloon to pre-dilate, and this is how you can see. We have to put the stent through this wire inside the coronary artery. कहते हैं इसको पिरोया जाता है, पिरो के जैसे धागा पिरोया जाता है ना, वैसे ही है ये. And this stent is then introduced through this system. Saline, pura. I want the saline.
Sir, saline change करने के लिए देगा थोड़ा.
Okay. So the stent will go inside this. This is two-way system, and the stent is now slowly going inside the artery. The guiding catheter is already there. बाहर आ गया क्या गाइडिंग? नहीं, ठीक है सर, बिल्कुल है, ठीक है सर. स्टैंड लीजिए सर, सब बाहर आ जाएगा. Cham, you will go. हाँ सर, हाँ सर. You can see the stent is going inside very slowly. That's all. Okay, we check the position. It's okay? Now we'll inflate. So here, with the help of this system, we will inflate the stent. You can see there, the stent is inflated. Inflate करके बैलून को ना आप गाइडिंग पुश कर दो. गाइडिंग पुश कीजिए. चेक करके गाइडिंग. बस. Okay, so we have already inflated to 12 atmosphere. So here, boost. You see, it is very well inflated. Boost it. Nikoran. Ready, sir. Boost it. Inflation हो गई ना सर. हाँ. Boost एक बार और. So I am inflating again, you can see the balloon. We are inflating again to 14 atmosphere. Come back to me. So I will explain to you how the system works. When we are putting the stent inside, it is wrapped over the balloon, and with the help of pressure, it will inflate the balloon and put the stent deployed inside the coronary artery. Now I have deflated it, and now the stent is deployed, and you can see the two markers. Actually, these two markers are the balloon marker, and we'll slowly remove the stent now. We'll take a check shot.
Dinesh Yadav, please.
Nikura, start. We'll take a check shot. Nikura hai? We'll give one Nicorandil intracoronary. I always give Nicorandil to be sure that the things are dilated. So artery is fully open. I remove the balloon now. Show here. I will remove the balloon from here. You will see the balloon is coming out. Actually, balloon was the carrier. Huh? Balloon is the carrier, and with the help of balloon, we have put the stent inside. Now I take out the balloon. Slowly I will take out everything. Now the balloon is taken out. Show the video, fluoro. Show the balloon. So you come here. This is the balloon which was the carrier of the stent. It is already removed. We don't leave the balloon there. We leave the stent inside the coronary artery. I will take the check final shot. And the artery is fully open. Just to compare. Okay, show the comparison. Show the comparison with the help of your fingers, Chandan.
Ji.
This was the blockage before.
Before.
Yeah. Okay, so now you have seen. Show the view. Show the view.
Fluoro.
Okay. You have seen this. Now come back to me. So I remove everything now. Tube is removed, and now the patient is only having these two sheaths, and this sheath will be removed slowly once the ACT is normalized. I check the pressure again. Show the pressure. Pressures are fine, but you're not able to give the good pressure here. Or down. Okay, so come back to me. So the procedure is complete. So there are two types of angioplasties. One is simple angioplasty, which takes about 15 minutes. And there is complex angioplasty, which takes a little about half an hour. When the artery is not in the right position, sometimes you have to struggle and take tricky wires and guiding catheters. This was like this. But 99% stenosis. And I will show you how it was like this before. This was the blockage before. Can you see this? It's all white. That means there's a serious blockage. And after putting the stent, the whole thing has become normal. So the artery which was having a 95% stenosis is now completely open with the help of stent. Patient is fully conscious. Namaste. ठीक है, कोई दिक्कत तो नहीं? बहुत बढ़िया. It's done in the local anesthesia with the help of our staff, and we are doing this procedure regularly all over the world. This thing started. Let me give you a little more introduction of angioplasty. The first angioplasty was performed in 1977. First stent was done in 1987 in Switzerland. But of course we are doing since 1998 here. Before 95, something like that. Now in 2020, this is one of the most important technique to save the life. Why? Because this 95% stenosis can cause 100% blockage and can lead to heart attack. Chandra will see a lot of time to bring the patient of heart attack, and then you are difficult to save the life of the patient. So with the help of opening the chest, without opening the chest, just from the groin, we have been able to salvage the coronary, the myocardium, and this patient will be discharged in 2 days' time. We have to keep the patient inside the ICU for just for observation. He's fully conscious, he's alert, there's no anesthesia, only local anesthesia. So I hope you will be able to understand that angioplasty is otherwise simple procedure, but should be done in expert hand with a backup. Sometimes there can be problem, but God willing, nothing happens here, and we're able to do a good job in such cases. Thank you very much. I hope you understand the angioplasty procedure. Dr. Vivek Gupta along with Chandan from Apollo Hospital, New Delhi, along with the nursing staff. And come, doctor. It's Dr. Agarwal, who is a resident doctor. Show your face. And we have done a good job. Thank you very much for watching this live video on Facebook Live.